injured, cut, bruised, depressed, unhappy. The human body goes through a lot of stuff in our life, don't we? A lot of things try and break our body. So how do you make sure that you've got a body that's unbreakable? Or if you do get broken by accident, for example, or bad luck, what can you do to get better quickly? How can you recover quickly? And the stuff that we've been taught, given the things that we think are true about injury, recovery, rehabilitation, physiotherapy, chiropractic, osteopathy, all the things that we do to recover from an injury, and then there's the medical practice to recover from a sickness or a disease. Are all of those things true, or should we question them? Now, I've been an exercise professional all of my life, and I'm a very old lady, and I've worked with lots of people who have been sick, injured, depressed, diseased, whether it's mentally or physically, and they've been given all sorts of diagnosis. The interesting thing I've taken note of, though, is that diagnosis for the same challenge can be very different by different experts. So a physiotherapist, chiropractor, osteopath, doctor, orthopedic surgeon, sports physician could give very different advice about injury recovery or how to prevent an injury, and often that information is contradicting each other. What do you do then? I'm the exercise professional, I've got a client that's got an injury or they want to prevent injury, but the information they're given from lots of different people is all different. So what do I need to do to make sure that my client recovers quickly or prevents the injury in the first place? That's one of my dilemmas as a personal exercise coach. The second one is that everything that we've been taught, because it's been argued about, should we go back and find out where that information came from? So why do we do that? Why do we do physio? Why do we do chiropractic? Why do we use a bandage? Why do we put a moon boot on? Why do we take antidepressant drugs? Why do we take statins? Why do we take beta blockers? Why do we take Fosamax for osteoporosis? There's a whole heap of drugs, interventions, opinions, ideas that have been around a really long time for looking after the human body, but how do we know that they're right? Now, one of the reasons I'm standing out in the fresh air and sunshine is I'm a very privileged old lady, and I share this with passion and enthusiasm. My mother was a nurse in the Second World War in Berlin, where there were literally no medications, there were no bandages, there was nothing that we have now, and certainly no machinery that worked to be able to help people if they were injured or sick. And there had to be a big focus on prevention, because the last thing you wanted to do during the war in Germany was end up in hospital, because that's where the sick people went, and you went there literally to die. I'm just quoting my mother. So my mother, as a nurse, wanted to make sure that whatever she did, and she was obviously a very beautiful nurse, because she wanted to help her patients if they were sick to get better, but ideally the people that she loved was to keep them out of the hospital, because that's where people got sick and died, literally. If you went there a little bit sick, you stayed there, got very, very sick, and then you died in the hospital. Interestingly, should we take note, could that still be happening now? If you have something a little bit wrong with you and you end up in the hospital, is it possible that it could get worse because the hospital has lots of sick people there, and I don't want to go there. How about you? I'm not interested in going to the hospital, and I'm not interested in going to the doctor. I want to stay healthy, fit and strong and prevent injury, disease, and even the bad luck stuff that there are some diseases that are certainly bad luck, and there are some injuries that are certainly bad luck. But a lot of the orthopedic surgeons have shared with me that a lot of people end up in the hospital with a broken bone from an accident. But if they were fitter and stronger, if they were more flexible, if they had better dynamic ability to move around because their muscles were strong, they probably wouldn't have ended up in hospital, or they wouldn't have had a broken bone. So I listen to all of that and I take note. The reason I take note is I obviously, as a person, want to be healthy, fit and strong, but I have a college that inspires, motivates, educates, trains people to think for themselves about injury, about the human body, about how the human body works, how to make sure it stays healthy, fit and strong for a lifetime. And if it's not healthy, fit and strong now, what do we need to do to get it that way? So that's a big, long story about, should we be thinking more clearly for ourselves? And that's one of my favourite quotes when it comes to education. Please don't let somebody tell you what to think. Somebody should be teaching you how to think for yourself if you're involved in education. If your kids are at school, wouldn't it be nice if the teachers were all teaching them how to think for themselves, analyse, research, study, critical thinking, resilience, rather than this is what you should think. We're telling you how you should do something, which is one of the things I do when I go to the doctor, and it's very, very rare, but I've been to lots of doctors, medical specialists, both for mental health and physical health, with my clients, because I've been an exercise professional for a very long time and a personal exercise coach. I had over 60 clients for a very long time on a regular basis. And they would often ask me, please come with me to the psychiatrist, the psychologist, the counsellor, the orthopaedic surgeon, the endocrinologist, the cardiologist, the many ologists that there are. So I've sat in many doctors' offices. And one of the things that I don't hear, and I have never heard in any of those experts' offices, is prevention and or why. Why did this happen to you? Medical professionals are very good at, okay, we're going to diagnose this is what's wrong with you, and here is a medication or a medical intervention or some kind of surgery or bandage or moon boot or acupuncture or physiotherapy or something to fix what's broken or busted or sick or diseased, but very little about how can we prevent it from happening again. In fact, I've never heard anybody say that. How can we make sure this doesn't happen to you again? And more importantly, why did it happen in the first place? And that's what I'm focusing on. So none of my business, if you're a parent, a teacher, a coach, a boss or a leader and people are coming to you for advice, you're going to give them whatever it is that you believe. But one of the things I've done as a personal thing is, why do I believe the things I believe? Why did I think that? And I'll give you just some classics. If I cut myself, I should put a Band-Aid on it. If I've got a sprain, I should ice it or heat it or wrap it. And there's a really big argument now about the difference between icing and heating. And some experts will say you should do one and some say you should do the other. And how more opposing can you get than ice versus heat? It's a really interesting question. Should I put a bandage on something? Should I put a plaster on a broken bone? Should I put a moon boot on a sprain? And they're very common, but I've always asked why. Now I'm going to go back to my mother, because my mother, again, in a hospital where there were no bandages, no moon boots, no plaster, no medical interventions and no pharmaceuticals, because my mother was in a hospital in Berlin right through to the end of the war, and there was nothing, literally there was nothing to heal people with that you could use, that you could call a medical apparatus or pharmaceutical. I'm sharing that with you for a reason, because I was then brought up with a mother who was not only a resilient nurse and a critical thinker, but she helped people get better without any of that stuff. She helped people prevent injury to keep them out of the hospital without anything. So I was brought up with exactly what I'm doing now. If you've got a cut, if you're sick, if you've got a flu, if you've got a virus, whatever it is, and I'll rephrase because there's a whole heap of argument about what all those things are. If you don't feel good, if you don't feel 100%, if you're not performing at your best, what should you do? And my mother was just a classic. She used to say, get out into the fresh air and sunshine and move around. We want oxygen supply, we want circulation, we want blood flow. Nutrients can't get to the places that they need to go if you keep still. So then that meant no bandages, it meant no plasters, it meant no Band-Aids. My mother was all about, and I'll just give you a classic example. I had a cut on my hand, and I've still got a big scar on it now, even though I'm a very old lady. I literally cut my hand off pretty much. My hand was hanging on by some skin. And I did it my father was a builder when he came to Australia after the war. And went to a building site and cut my hand. Now my mother, the classic part of this is, oh look, you've cut your hand, and she had a laugh. Because if you panic, if you're stressed, if you hesitate and make the patient feel upset or sad, and that's an interesting side note. Every paramedic I've ever spoken to, they've all shared with me that the best form of first aid that you could possibly give is to be cool, calm and collected under pressure, which my mother certainly was. And she went, oh, look, you've cut your hand, and laughed. And she put pressure on it straight away. Yes, she bandaged it up because it was cut, but I didn't get any stitches. I didn't get any medication. I didn't get any pills. I didn't get any painkillers. My father was an excellent joke teller, and my mother straight away said, tell her some jokes, make her laugh. and she bandaged it up really tightly. Then every day after that, I had to take the bandage off for a very long period of time, hold it, or come out into the fresh air and sunshine. My mother washed it with clean water and soap, not with any kind of antiseptic or anything. And it healed very quickly, to the point where even today, if a doctor looks at that, they go, oh, that's a good scar, but you've got no stitch marks. And you're an old lady, how come? And I would explain what my mother did, and they, of course, all laugh because that's not how you treat cuts anymore. But I'm just really aware that that was a very effective way for me for my hand to heal, and it's healed perfectly. It works normally, and that's amazing. I'm not telling you to do that because my mother did. I'm just aware that we might have been told some stuff about medical interventions, pharmaceuticals, processes, that there might be a better way. I certainly don't want to put drugs into my body. I don't want to, and this is again a very sad side note for me. Just recently, in the last couple of days, some people in my life have had serious injury and or very painful, have had a very painful bone or muscle experience. And without any x-rays and without anything except, I'm sore, can you please help me, they were given some very serious pain-killing drugs. Morphine, oxycodone, the stuff that you get addicted to very, very easy. And they were given those drugs all they had to say to the doctor was, I'm in serious pain, can you please help me? And not only did they get those really strong mind-altering drugs, addictive drugs, they were given a large amount of them. I have to calm down because I've been a results coach and exercise coach all of my life. I've worked with a lot of people that have become addicted to painkillers, pharmaceutical drugs, not just heroin, cocaine, methamphetamine or marijuana, but actual pharmaceutical drugs that were prescribed to them by a doctor, and now their lives have been completely and totally ruined because they're addicted to such a mind-altering drug, including antidepressants and brain-altering drugs. I would like to avoid all of that. Now, I'm not saying whether they're right or wrong. I'm not a doctor. It's none of my business. What I would like to do for me, for the people that I love, for the people that I care about, and I'm sure if you're a parent, a teacher, a coach, a boss, or a leader, you have people in your life that you care about. If they get sick, you want them to get better quicker. If there's a possibility that you could prevent the sickness, the injury, the illness, you would, then should we reassess the information we've been given? So there's some really nice studies that have been done by psychologists, psychiatrists, neuroscientists, exercise physiologists to show that the benefit of taking a mind-altering antidepressant, for example, is nowhere near the effect of having a fit, strong, healthy body, which you then, if you get puffed, you lift heavy, and you change your brain chemistry by your body's own ability to do that, fight and flight, you produce epinephrine, adrenaline, cortisol, and then you produce dopamine, serotonin, norepinephrine, endorphins, brain-derived neurotropic factor. So you make your brain stronger and better naturally. And then there's that beautiful new system that most people don't even talk about or know about, is the myokine system, which is technically how muscles get stronger, or how the body gets stronger, because the muscle itself sends a message back to the brain to say, we've been overloaded, we need to be better for next time. So the body gets better all by itself. So this is just my begging position, because this is the question. The world is full of medication, drugs, surgery, medical interventions, and lots of opinions about what you should do if you get sick, injured, diseased, or depressed. But none of those are making us any better. We're fatter, sicker, weaker, diseased, more depressed. The human race is getting worse and worse. If we were taking these great drugs and we were getting better and better and we were the healthiest we'd ever been, then that would be a nice thing to study too, wouldn't it? But that's not the case. Our kids are fatter, sicker, weaker, depressed. Our kids have got old people's diseases, and yet we're filling them up with all sorts of medical interventions and drugs, and covering their little cuts with Band-Aids, and we're covering their if they've got a sprain, we put a strapping on it, and there's a whole heap of things we keep doing. But there's a great expression. If you keep doing the same thing over and over and expect a different result, that's called insanity. And if it isn't working, why would you keep doing it? So whatever we're doing isn't working. And I'll just use a simple example as an exercise coach. The exercise programs and the eating plans that we have been preaching at people since I've been in the profession, which is over 40, nearly 50 years, is it's not working because the world is fatter and sicker and weaker and more depressed and unhappier than it's ever been. So it's not working. So I'm constantly every day, that's all I focus on every day, is how can we prevent, cure, help people recover quicker if they are sick or injured or if they've got a challenge. My ultimate is prevention. How can we stop this from happening? If somebody's unhappy, rather than give them a mind-altering antidepressant drug, why did they get unhappy in the first place, and can we change that situation? If somebody keeps getting injured, and again, an interesting side note, my mother, when she got older, got several broken bones. And so they put her on Fosamax, which is the drug for osteoporosis. They diagnosed her with advanced osteoporosis. They ordered her a wheelchair. She already had a walking stick. And that was going to be the rest of her life. But we just said no. My gorgeous husband and I, he's got a master's degree in exercise science. He's a biomechanist. He's a published research scientist. He just said to my mother, no, we're not doing that. You are going to get healthy and you're going to get fit and you're going to get strong and you're going to have great quality of life. So she started boxing for her bones, which is pressure through the joints and the bones. She started doing heavy weight training, pressure through the bones, muscles getting stronger, bones getting stronger. Obviously, your immune system's built inside your bones. So my mother got all the horrible diseases that she had, coronary heart disease, type 2 diabetes, osteoporosis, asthma. She was just a rattling pill machine. She got rid of all of that medication. She became a healthy, fit woman. And from the age of 74 to her next bone mineral density test at the age of 80, we got rid of her osteoporosis. We got rid of it. So why not prevent it in the first place? Doesn't matter how old you are, whether you're 5 or 15 or 25 or 85, your body will overload. If you get fit and you get strong, you can get better. And if you get fit and you get strong, you can prevent most of the horrible diseases that we now have that we give ourselves by mouth and by inactivity. So if you want to live your life to the max, it's a very simple thing. If I wrap everything up, and I've been chatting for a long time about all the challenges in the world, but what about this? What if you were really fit and really strong and you had a positive attitude? If your body was the fittest it possibly could be, is it possible you'd recover quicker and or you're less likely to get sick? If your body's as strong as it can possibly be, mentally and physically, is it possible that if you have an accident, you'd recover quicker and or you'd prevent from ever having an accident? Because if you trip over, and I'll use my mother as an example again, she broke several bones. After she started doing strength training and boxing, she often tripped over, but she never broke anything because her bones were strong again. I'm about prevention and living my life to the max. I don't want to go to the hospital. I don't want to go to the doctor, and I don't want to take drugs. I don't want to put crap in my body. And I'm appreciative of the medical profession because there are times when we really need them. But I don't want to waste their time on a body that could be healthy, fit and strong by itself. I don't want to waste their time because I get injured or sick or diseased and depressed by things that could be prevented and or I could fix myself. So I'm in the fresh air and sunshine. I'm about to get puffed. I'm going to take my dogs running. I'm going to work in the garden. And again, it's a very fun side note. I cut myself in the garden all the time on rocks and on weeds and on pieces of stick. And I'm constantly, my body's always got bits of broken, but boy do I recover quickly. I get injured all the time because I trip over things and I fall over and I fall down rabbit holes, and I recover really quickly. I've got a positive attitude. I'm healthy, fit and strong. I get out in the fresh air and sunshine, and the first thing I do if anything horrible happens to me is I laugh, because a positive attitude is obviously a healthy brain. So some things to consider. If you are a parent, a teacher, a coach, a boss or a leader, could you please, before sending someone to the hospital or putting them on mind-altering drugs or wrapping them up in a bandage, could we consider that maybe fresh air, sunshine, a fit, strong, healthy body and a positive attitude could be a fundamental foundation place to start, rather than let's race you off to the hospital or the doctor? Something to consider so that you can live your life to the max. I do live my life to the max. Woo! Live your life to the max. Check it out.